Hello, good afternoon or good evening, everybody. Welcome to our Instagram live session from the Nimi Hospital Group, Abuja. I think I'll introduce myself first. Okay. So my name is Dr. Awofisoye, Oyindamola. I'm the medical director and the consultant physician at Cardiocare Multispecialty Hospital, which is a branch of the Nimi Hospital Group. With me here is
Nwafor.
Okay, so we'll be having a very interesting discussion this afternoon, and this is one of our Instagram live series. I'm not sure whether you joined before. We do this on a monthly basis, and this month's topic is a very interesting one, which I want to believe that we'll all find very going to be a nice conversation. Basically, what's our topic for today? Can you tell our audience?
Okay, our topic for the day is tuberculosis.
Absolutely. So we're talking today about the symptoms and the management of tuberculosis. So stay tuned. I think it's going to be a very engaging session, and I think it's going to be worth value for your time. I encourage you at this time, if you have friends and you can share the link with them so that we can all benefit from this discussion we're going to have. So do you know why we chose the topic for today?
Yes, because tuberculosis has proven to be one of the major problems we have in Nigeria.
Absolutely. So tuberculosis is a big problem, and in fact today is World Tuberculosis Day. So today is March 24, and we're marking the World Tuberculosis Day today. We'll not use the term celebrating. I think we're marking it because there's a very serious cause of concern, really. Okay, so Nigerian Nimi Hospital is joining the entire world to mark the World Tuberculosis Day today. And it's sad that at this age and time that tuberculosis is still a problem, actually. Yeah. So it's an age-old problem, right from I don't know how many years ago, more than 100 years ago, tuberculosis has been known. It has been killing people. But it is sad that even at this age and time, it is still killing people. It's still a big problem. Why do you think tuberculosis is still a big problem?
I think it's still a big problem because most people don't really know about tuberculosis, and even those that know really neglect it a lot.
Absolutely, I think I agree with you. I think there's a lot of poor public awareness about tuberculosis, and I think that's part of the things that inspire having this discussion on World Tuberculosis Day annually, and why we actually choose to buy into this and use the opportunity to inform the entire world as much as possible about tuberculosis. So I think I'll start by saying what tuberculosis is. I think that's a reasonable place to start, right? So I know that we have a mix of audience, medical, and laymen, okay? But tuberculosis, is it an infection or what is it?
Bacterial infection.
Okay, so it's a kind of bacterial infection because those bacteria are so sophisticated and they have their own kind of class, and we call them mycobacteria. So we have those mycobacteria. In medicine, micro is typically used for like fungal organism, actually as fungus. Okay, so but these bacteria just behave so differently. One of the key ways they behave so differently is because they are slow growing. Okay, they divide very slowly. They can be indolent. They don't show their face very well on time. So it's an infection that's caused by Mycobacterium tuberculosis, and that's what tuberculosis is. And usually when we say tuberculosis, generically, it typically means tuberculosis of the lungs, but we also know that tuberculosis affects other parts of the body. And what other parts of the body does tuberculosis affect?
It affects the abdomen, it affects the spine,
okay.
It affects the lymph nodes.
Absolutely. So tuberculosis can affect the brain, it can affect literally any part of the body.
Yeah.
So tuberculosis is age-old, is something that we've known for long, but sadly it's still something that is still killing our people. And it's also important to note that Nigeria is one of the problem TB countries in the world. I don't know a better way to phrase it, but one of the countries in the world with a very high TB burden. In fact, don't say you heard it from me, but we have the largest number of people that have tuberculosis in Africa. So Nigeria is the country with the highest burden of tuberculosis in Africa, and that's a big one. That's a very big one. So we have a lot of work to do, and apart from having the highest burden in Africa, we know that globally, that's in the entire world, we have up to about 10 million cases of tuberculosis in the world. That's a huge number. It's estimated that in Nigeria alone, about 250,000 people have developed TB every year. Every year, about 250,000. I'm not sure how many people are in my village. I won't mention the number of my village, but the entire population of my village is probably hardly up to 250,000. Just imagine that number of people not developing TB, dying from tuberculosis every year. So that is a big issue. And as a doctor practicing in internal medicine, I see these things every day. We see people with TB that are presenting clearly as TB or presenting one corner way that no, you will not know that it's TB, but it's TB, and then sadly, still an unacceptably high proportion of people die from this condition. So, but why is it happening like this? Why is it happening like that? I think that's a big question, because this is not a condition that does not have a treatment. There are very effective treatment for tuberculosis. In fact, it is free in many government centers. So what we should ask ourselves is that why is this still happening like this? It's also a leading cause of death globally. I'm not sure whether you know that. In fact, it's a leading infectious cause of death. It's a leading infectious cause of death. It's only COVID overtook it during the peak of the COVID epidemic, but after that, went back to TB. The other close things that are important include malaria and other things like that.
Yes.
Yeah, so why do you think some people have a high chance of having TB?
Because of the low immune system.
So the conditions that make our immune system weaker makes it more likely for someone to have tuberculosis.
Yes.
So I think that's important to say that. Okay, but looking from a socio-demographic perspective, we know that TB is more common in certain social settings, and that's why saying that Nigeria or countries like India are countries with very high burden of TB is not just a random thing. It happens in actually the less developed countries of the world, and it means that there has always, even though of course it's not a compulsory factor, but there's always been an interaction between social status and the socioeconomic conditions and our likelihood of developing TB. So TB is more common among people of low socioeconomic status, in slums, in very highly urban areas in which people are living close to each other, they're overcrowded. So things like that are very highly linked with TB. And apart from that, you also mentioned about the immune system. There are many conditions that can affect the immune system. I think the most dominant of them is what is HIV, I would say. So HIV is a condition that has gotten increased prominence over the last maybe several decades, and unfortunately continues to be a problem. And there's a very unholy alliance between HIV and tuberculosis, such that someone that has HIV is at least 4 to 10 times more likely to have TB compared to someone without HIV. So HIV actually has affected the cause and the natural history of tuberculosis, and of course it affects our ability to pick it, our ability to detect it, even our ability to treat it. So that's a big game. That has been a big game changer. Fortunately, there has been more effective treatment for HIV over the years, and people with HIV are beginning to live a longer, happier, and healthier life. So that's a good part to it. What are the other risk factors that you are aware of for tuberculosis? I'm talking about the epidemiological issues.
Risk factors like smoking.
Yeah, definitely. So smoking is a risk factor for any respiratory disease, actually. That's the truth. So anybody that smokes, and I will advise any of our audience that smoke, but try to stop it. Smoking is not good for you in any way. And sometimes if you think you require medical or healthcare assistance to stop smoking, please talk to your doctor, talk to your GP, and usually they can give you guidance and support in stopping smoking. So smoking cessation is very important. Also, people at extremes of age, so children and older folks, they're actually quite more likely to get tuberculosis, and they are more likely to die from TB compared to young, fit, healthy adults like me and you. So people at the extreme of age are at more risk for that. Apart from that, we also know that diabetes is a disease that affects our ability to respond to infections or our immune system. So diabetes also increase someone's risk of TB. And apart from diabetes, other things like excessive alcohol use. So TB is actually excessive alcohol use weakening the immune system and making someone more prone to having tuberculosis as well. Can you think of any other risk factors for tuberculosis? So actually, absolutely. So poor ventilation, overcrowding. Okay, but going to individual risk factors now, other things also can come in, like having certain conditions. People with transplant, for example. So if someone has a kidney transplant or another organ transplant, so if they're on medications that are supposed to suppress the immune system, or patients with other conditions that makes their immune system not as strong as it should be, they will be not so be able to fight tuberculosis. Of course, we should remember people that have contact with people that have TB. So healthcare workers like you and me, we take care of patients with tuberculosis. We have a bit higher risk than the general population of developing TB. And if you as an audience, maybe you have a family member that has TB, or you're exposed to someone that has chronic cough that may be TB, it slightly increases our risk for developing TB. So I think that generally summarizes the risk factors for tuberculosis for us. I think the next thing to go out is how will someone know if they have TB? What do you think? If someone has TB, like, so let's say Mr. Ali, is somewhere now and is wondering whether he could have TB, what symptoms would he have that would suggest that maybe this could be TB?
Okay, the person could be coughing.
Okay, so cough is the most common, maybe central feature of tuberculosis. And I've seen these posters here and there several times. I'm sure we've probably all seen it. So if you're coughing for more than 2 weeks, it could be TB and you should get tested. And I think I totally agree with that. It's one of the things, one of the tools we use to identify cases early so people will know how, if they have TB or not. So cough, if you're coughing, of course, cough is a very common symptom. So unfortunately, common cause of cough, cold, virus, allergies, and things like that. So cough is very common, but some coughs could be TB. So what are the things about a cough that will tell us that maybe this could be TB?
Resistant coughing,
Absolutely.
Severe coughing.
Absolutely. Well, it doesn't have to be severe anyway, but if someone is coughing and the person has coughed for more than 2 weeks, we say, if someone has coughed that's lasted for more than 2 weeks, we should ask ourselves that could this be TB? Okay, it doesn't mean that it is TB, but could this be TB? So if someone is coughing and having cough that's lasted for more than 2 weeks, it could be TB. There are other characteristics that the cough can have that can tell us that this could be TB, and that includes things like coughing, a cough that is productive of mucus, particularly the mucus has funny color, yellowish, greenish, brownish. Okay, and then sometimes you can get blood streaks in the sputum. What do we call that medically? We call that hemoptysis. Yeah, hemoptysis. So if someone has hemoptysis, it makes it more possible for that cough to be tuberculosis. Of course, other things can cause it as well, but it just raises that question. Okay, the other symptoms too, you're mentioning fever earlier. Okay, so if someone has a cough for that 2 weeks and also having fever, what's fever again medically?
Fever is when your temperature is above 37.2
Absolutely.
37.4.
Absolutely. So basically you have a hotness of the body, and usually we check with the thermometer, the temperature is high. So someone can be having fever as well, which can be low grade or high grade in tuberculosis. Usually that comes with chills, right? Chills is that feeling you have, you're feeling cold, or you pour cold on your body, you feel. And there's something that is quite a bit particular to TB as well, weight loss. So if you're having a cough and you have weight loss with it, please have it checked out. Why? Because cough with weight loss, with fever, lasts longer than 2 weeks. Is medically serious, and you have to have that checked out. So weight loss is important to note if someone is having a cough. And also night sweat is quite common with tuberculosis as well. So night sweat is common, particularly when there's a drenching night sweat. That sweat is typically enough to make the person's clothes soaked, so that some of them, sometimes they will have to have a change of clothes in the course of the night, okay? Of course, tiredness is very common with tuberculosis, so the person feels tired all the time. Some people might notice swollen glands in addition to the cough, but again, I want to emphasize that the most common and dominant symptom with tuberculosis is cough, okay? And because of this, if anyone is having cough that is lingering longer than 2 weeks, you should have it checked out. And also as healthcare professionals, it's easy to try to attribute something to maybe something else and the other. I dare say that anybody that has a productive cough more than 2 weeks should have a chest X-ray done. The person must be evaluated for possible TB. I mean, also as healthcare professionals, you have to ask yourself that, okay, could this be TB? Okay, and until we satisfy ourselves that this is not likely TB, and we should actually make sure that we ask all the necessary questions to determine that, okay, this is likely, or no, this is likely something else. Of course, TB can present in other parts of the body as well, and you did mention TB of the spine area, which we call Pott's disease medically, and that usually can cause back pain, can cause a fracture of the spine, and of course it can cause weakness in the legs of the person. So it's one of the causes of weak legs, makes someone not be able to walk well or requiring a wheelchair to move around. Okay, so I think those are the most important symptoms of TB. Now, we did mention earlier that TB can affect any organ, and because of that, it means that it can still present in many other ways that will be outside the scope of this discussion. Once again, we're at Limi Hospital Instagram live session, and this afternoon we're having this fireside chat about tuberculosis on World Tuberculosis Day. We're focusing on the symptoms, diagnosis and management of tuberculosis. So we've talked a bit of how common and how serious the issue tuberculosis is. We've talked a bit about the common symptoms of tuberculosis, and we did emphasize that cough, productive cough that typically lasts longer than 2 weeks, is a central feature. Weight loss, fever, night sweat, and other things like that. It's important to recognize these things and assess the person for a possible existence of tuberculosis. Again, it's a very treatable condition. They are very effective treatment for tuberculosis, and the treatment works. Okay, so of course there are many challenges with using symptoms as a diagnosis. I did mention earlier that the symptoms are very common. The symptoms are very common, and because of that, I mean, I don't know, when last did you cough? Cough is a very common symptom, okay? So teasing out which one is TB and which one is not TB, and that's what's caused for those individual case assessments, okay? There's also something about stigmatization. We found a lot of it during the COVID epidemic, such that people that had COVID and were coughing, they would just try to suppress their cough and hide their cough so that nobody will know that they're coughing. In fact, sometimes someone will cough and then someone just look at the person like, did you just cough? And you have COVID and all that. So TB sadly is a stigmatized condition, and it need not be so, because it is a condition that is not by anybody's doing. It's not because of the fault of the person otherwise, and it's a treatable condition. It has good and efficacious treatment. So I think I'll leave the symptoms at that. And so how do we diagnose TB?
Chest X-ray, sputum smears.
So that's absolutely fine. You know, Splitting is jumping right into it. But so there are many tests we use to assess to make a diagnosis of TB. It's important that the person sees a healthcare professional. Person asks questions. Patient is examined. There are typical signs that we find on examination, but because of our mixed audience, I won't go into that. Okay, but there are many tests that can be done to help us make a diagnosis of tuberculosis, and it's important to go through these tests as directed by our healthcare professional. So basically, I mean, one of the most important tests she mentioned just fast is X-ray. X-ray is extremely very central to the diagnosis of tuberculosis. Okay, and there are many things that we can see on X-ray. I wish I could show some pictures so that healthcare professionals can rub minds on that. Okay, but X-ray is very central and very useful in the diagnosis of tuberculosis. There are many things we can see. There are many kind of shadows that we can see on the X-ray, and some of them, when you see, even if you don't know anything about the person, you just wonder that this looks like TB. Okay, so sometimes one of the common things that we talk about are shadows that has a light center. We call it cavities. Okay, so cavities typically is just a space that contains air that has a very thick wall, and you can see that on the X-ray. Anytime you see cavities on X-ray, it's very suggestive of tuberculosis to us. Of course, there are other causes of cavitations on X-ray, okay, but TB is what comes straight to mind. Now, especially when you live in a high burden TB country like Nigeria, where TB is very common. It means that the pre-test probability is even very high and makes that more likely to be. So there are some things that healthcare professionals can see on X-ray and can suggest that this is TB. Sometimes you see what we see called like a miliary pattern, which you see almost grains of rice size specks all over the lung. You just see chuk, and it's very bad. And those kind of patients are usually very sick. Okay, so we can see that miliary pattern sometimes. Sometimes it can cause water to accumulate in one part of the chest or the other. Medically, we call that pleural effusion. So it can cause pleural effusion as well. And of course, it can cause scarring of the lungs. Okay, so there are a lot of things you can see on chest X-ray. And chest X-ray is one of the very first line investigations for making a diagnosis of tuberculosis. In fact, in many places, I'm not sure when you school, okay, but in my school days, when you're entering school, one of the things they do, screening test they do for when you're entering is just chest X-ray, just to pick whether this guy has one tuberculosis that is lurking here and there. So it's important to do a chest X-ray when someone is being evaluated for TB. What are the other tests that we can do when making a diagnosis of tuberculosis?
Okay, sputum smears.
Absolutely. So sputum, what's sputum again? So sputum is that thick mucus that someone brings up when the person coughs, okay? So that can be tested in many ways for the tuberculosis, and it makes sense, because most cases of tuberculosis affect the lungs, and because it's right there inside the lungs, that's that mucus, that's sputum. Now there's saliva and there's sputum, and the normal saliva that you can just spit out, the saliva is thin, it's almost like water that is just forming a bit. Okay, but that mucus, that thick one that looks like catarrh, that's the one that can be tested and can be used to see whether tuberculosis is found from your lungs or not. Okay, and there are different ways by which this can be collected. There are different tests we can do on this, which I'll go into a little bit. Okay, but the key thing is that the sputum that is produced for the test is very important, because if it's a real thick sputum that's coming from the lung, it's likely to be more representative of what's going on in there compared to just spit that you just bring from your mouth and you just spit in the container. So it's important to get reliable sputum for the test, and then we do special stains on this sputum. There's a general test that can be done on the sputum, okay? But for tuberculosis, there's something we call Mycobacterium tuberculosis specific stain. Okay, that's a tuberculosis specific stain, and there are several of them. The most commonly used are two. One of them is what we call medically Zell-Nelson stain, which is very old, older than you and I, okay, very old, they've been doing it for more than 50 years, okay, and then there are other newer stains, including the Oromin rhodopsin test, and many other staining techniques that can be used to stain for tuberculosis, okay. The problem with this sputum stain, or just staining the sputum, is that it can only pick so many cases. The amount of bacteria that is there has to be very much before you can pick it, and that means most cases that even really have TB can be negative and test negative on the sputum test. Okay, but that sputum stain is actually one of the first sign tests after his chest X-ray to diagnose tuberculosis. What other things can we do on the sputum?
Malthus test.
Okay, so on the sputum. Say. Okay, so apart from the sputum, so we're going to do sputum culture for TB. Now, sputum culture for TB takes a long time to come, and that's a drawback, okay? And it requires some special culturing medium, which may not always be easy to get, okay? So, but it can be cultured, and it's something that also tells us specifically that tuberculosis is there. So those are the two main tests that can be done on the sputum. But over the last few years, we've also had some other additional tests we can do, and it's because of the weakness in these initial tests that makes us have to develop those more sophisticated tests. I did mention earlier that up to half, about roughly half, even more than half sometimes, of patients with TB that really have TB will test negative to these smear tests, and that means we have to have other ways of diagnosing it. Now the culture has a bit of a better yield, okay, but the conditions required for the culture requires more sophisticated laboratory techniques, and then of course you don't want to expose the person in the lab, so a lot of issues come around there. Okay, and one of the most sophisticated tests we have for these days is a test that we call GeneSPAT. Have you heard of the GeneSPAT test before? So beautiful. So GeneSPAT test is one of the called something PCR. PCR is polymerase chain reaction, and PCR is one of the key tests that we use to diagnose COVID-19, right? I'm sure people heard of PCR during that time. So there's some PCR-based tests for Mycobacterium tuberculosis, and one of them is the GeneSPAT test. The other one is the NA8, that's the nuclear acid amplification technique. But basically, particularly the GeneSPAT test is what has changed the game for us recently, because it allows us to detect tuberculosis in a sputum sample, that's in the sputum sample. It also helps us to tell whether it is resistant to one of the common antibiotics that is used. So that is a two-pronged advantage. So when we are able to get answers from the first method I mentioned, when the second method is not practical, the first method I mentioned is the sputum stain, okay? The second one I mentioned is the sputum culture. If we are not able to get answers from that, one will have to go to this GeneSPAT test I mentioned, or that PCR-based technique. And these techniques are actually quite helpful in helping us to make a diagnosis of tuberculosis. So I think those are the key things to mention. Of course, in ideal places, we also do what we call drug sensitivity test for the tuberculosis. That basically means that we're testing the tuberculosis that was grown after culturing it to see that it is going to be sensitive to the drugs that we plan to use to treat it. Because, yes, I said the drug works excellently, but it's not 100% of the time that it works. Unfortunately, because of some things that have happened over the decades, we've had drug-resistant strains which are not responsive to the typical drugs we use. I'll get to that later on, okay? She did mention another test earlier. What's the name of test you mentioned? You mentioned Mantle test, absolutely. So there's some tests we call tuberculin skin tests, okay? In which we use the skin to test for tuberculosis, and they inject something under the skin. I don't know whether you've done that before. I have. Healthcare workers typically do it from time to time, actually. And we try to see the response of your skin to it. And people that have been infected with tuberculosis before, they tend to have a kind of aggravated reaction to that skin injection. And now the utility of that test is quite limited in high burden TB countries like Nigeria. So it's not a very important test for us in diagnosing active tuberculosis, but it can help us in telling us whether someone has been exposed to TB or not. Okay, hope I'm not losing you guys so far. Once again, my name is Dr. Awofisoye Oyindamola with Cardiocare Multispecialty Hospital, a branch of Limi Hospital Group. And with me here is Nurse Lucy. Okay, I think we just about Lucy. I think your second name is to be tough to call. So with me here is Nurse Lucy, and we're talking about symptoms, diagnosis, and treatment of tuberculosis. Today's World Tuberculosis Day, and we're doing our bit to try to help lessen the burden of TB in Nigeria. One of the key issues driving the high burden of TB in Nigeria is poor awareness. Okay, and we're trying to increase all of our awareness for tuberculosis such that we can have more case detection and more successful treatment. Okay, so we've talked so far about the burden of TB, we've talked about the case with Nigeria, we've talked about signs and symptoms, we've talked about things done for the diagnosis. I've mentioned some of the challenges with diagnosis for earlier on. Okay, I did mention that the most commonly done test. I didn't talk about the limitation of the X-ray. The findings on X-ray can also be caused by some other conditions. So you cannot say you diagnose TB conclusively from an X-ray usually, except if other modalities are not helpful. Also, I did talk about the sputum stain that many times is negative. In fact, from my experience, many times it's more often negative than positive in people that really have TB. I've talked about the culture, requires sophisticated techniques. It takes too long to come out, okay? And I've talked about the PCR-based techniques like GeneXpert, etc., etc. Okay? So I think those are the key things about the diagnostic modality. She also mentioned about the mantle tests, the other tuberculin-based tests. There's a test we call IgRA release assay, which is like a blood test you can do too. Okay, but it's also limited. It has its own limitations as well, especially in this part of the world. So we have a lot of false positives and false negatives. And sometimes it's possible for someone to have tuberculosis and it might be difficult to find a test that can conclusively prove that the person has tuberculosis. But I won't focus on that. I will just let you know that for the vast majority of people with tuberculosis, with these simple tests I mentioned earlier, which are available well in many parts of the country, in fact it's free in many governments or foreign organization sponsored centers, TB can be reliably diagnosed. Okay? So after we diagnose TB, what next? We have to treat it.
Yes.
So how is TB treated?
First of all, after we confirm that the patient has tuberculosis,
Yes.
we start to protect ourselves quarantine.
Okay, so you mentioned the key thing now, so that if someone is found to be confirmed to have tuberculosis, you actually have to take steps to make sure that people around the person is protected. I mean, we want to protect the person himself, we also want to protect people around him. So the other guy we managed, one guy had TB. The guy had like a 3-year-old at home, had a wife at home, the wife was even pregnant. Okay, we have to take steps to protect these people, and we have to tell them that guy, this is how it is, this is what you have to do. And he was happy that and thankfully we tested the child didn't have tuberculosis, at least yet. And we're able to protect that child, and the child did not develop you. So we have to take measures to protect the person, okay, and the family members. So typically, if someone has what we call smear positive TB, or sometimes we use the loose term open TB, if someone has an infectious TB, you have to protect the people around the person, and you have to typically isolate the person. So the person may have to stop sleeping in the same room as the wife and children, be moved to another room. Some people even move to another apartment during that phase of treatment, okay? So, and it's important that when the person comes close to loved ones, the person should wear a face mask and stand at a distance as much as possible. Don't forget that tuberculosis can be transmitted by coughing into the air, by talking, by singing, particularly in a place with limited ventilation. Okay, so if you have somewhere that's just a bit kind of like enclosed, and then someone with TB is just talking there, and then you're there in that room. The person may not have coughed though, but you can inhale the tuberculosis. So okay, so it's important to use that face mask as a protector. So basically, we want to make sure that we protect the people around the person. Of course, healthcare workers around the person too should take the necessary protective steps to protect themselves. So that's important. We use the term isolation. We probably won't use the term quarantine for now, but in context, it means the same thing. You should protect the people around the person. Okay, in some places, the person is working in a workplace. Let's say the person is working in a choir, for example, or in one enclosed area. The person has to stop working until the person has been treated to a certain extent that the person is no longer infected again. So that it's important to take a precaution. It's also important to educate the person about tuberculosis, mode of transmission, and how to protect other people around there. Also important to educate the person about how it is treated, the issues with treatment, and how we can gradually get better so they know what to expect. There's something we call contact tracing. Okay, I've hinted a bit about it now, but it means that we healthcare providers, when we find someone with tuberculosis, we actually take proactive efforts to actually find the person the people that the person has spent time with in the last few months. Okay, because it's possible to have transmitted TB to them. Now this goes beyond just casual contact. It will go to maybe people like workmates, housemates, roommates, people that they spend time with, and it's where we ask questions, find out how long they spent with these people, and some of the people will qualify for testing. So it's not uncommon for someone to have tuberculosis at a workplace, and they say that everybody that works in that unit that shares that cubicle should come for chest X-ray or come and be tested. Doctors will ask them questions. So that's contact tracing, and that's part of the things we do to limit the spread in people that we have found to have tuberculosis. Okay, so those are important to do. Okay, and of course there are many other evaluations that needs to be done. We did mention about tests to do to confirm that someone has tuberculosis earlier, but it's also important to check for certain things that will affect the way we treat the person and will also tell us the risk factors the person has for tuberculosis. Two things come to mind very fast. We need to know the person's HIV status is important. In fact, it is, you cannot treat TB in someone without knowing the HIV status. So it is important, it's compulsory to know the patient's HIV status. And of course, other things like diabetes and other things that can affect the immune system needs to be checked. Usually also we do a baseline liver function test because of the drugs we're going to use. And after that, treatment is commenced. We should not forget what I said earlier, that TB is a treatable condition. It's a totally treatable condition and responds very well to treatment. People get better after the treatment, and it's not something that you treat long term or lifelong. No, it's something you treat and you complete the treatment and it has gone for good. Okay? So we treat TB with antibiotics. Okay, so TB is a bacterial infection, it is treated with antibiotics. Now, but there are some dedicated antibiotics that are dedicated to TB that we virtually don't treat any or many other things with it. It's just TB we use to treat. So those antibiotics have been, I'm looking for the word now, they have been consecrated onto tuberculosis, so not for anything else, just for TB. Okay, and there's a way in which we treat it. Now, earlier on, I did mention that TB is a slow-growing organism and it's a chronic infection, so it's a long-term infection. And because of that, the treatment is not just one 7-day treatment or 1 month treatment or anything like that. It's a long treatment, it's a long-course treatment, and that treatment needs to be completed. Yes. Okay, so that treatment is important. Okay, so we treat the person with a combination of antibiotics. Unfortunately, too, because it's slow-growing, it's kind of like less susceptible to antibiotics. So we don't just use one antibiotic to treat it, no. We use a combination of antibiotics, like it's just like you have a very bad criminal and then you have to shoot it, bomb it, throw a knife and just do everything together so that no, the guy cannot escape. And that's why the treatment is effective. Okay? So the treatment invariably of course has to be done under the guidance of a healthcare professional. So there are some medications we use. The treatment course is typically for 6 months. Okay, now each patient can have certain variables that can make the person need to be treated for longer. Okay, but typically it's 6 months, and at least 6 months. So that 6 months has to be completed. Okay, the number of medications, the medications are more in the first 2 months. After 2 months, the medication reduces, and the patient gets medication for that duration of time. And medications are well tolerated, even though for someone needs to be monitored while on this medication. Okay, so again, treatment has to be in the context of a healthcare setting, either a full-blown hospital or a dedicated TB treatment center, which there are many all over the country. Okay, and the treatment is done in that context. And now there's something we call directly observed treatments, shortcuts, I think. So for most people, actually we want to be sure, because one of the challenges we have with the treatment of tuberculosis is people not completing treatment. Oh, it's very common for people not to complete treatment, and it's one of the main problems we have with TB treatment. In fact, that is why we have drug-resistant tuberculosis, which I'll talk about along the line. So people sometimes know it's a six-month length of treatment, and it takes quite, it's a bit tiring, and it takes quite some determination to pull through with it, especially if you start feeling better after 1 or 2 months. You're like, can't I stop? I feel fine now. And sadly, I've had some patients have done that. Unfortunately, I've also had to be careful of many patients that have had drug-resistant tuberculosis. Drug resistance is a big problem in tuberculosis, and that's one of the threatening things we're having in relation to tuberculosis and also infections globally at this time. Okay, so it's important to pull through with that duration of treatment, and as I said, it has to be under the guidance and direction of a healthcare professional. So usually we want to be sure that the person is using the medication. For very high risk people, they actually may have to come daily to a center and be seen to use their medication. But in other cases, usually we give the drugs in intervals of weeks, and we know when the person, so that if the person stops it, you tend to know. And usually we mark it in a card or in an electronic register that this person is using the drug, so that we know that person. And at the end of treatment, usually the person is given a clearance that now you are TB free. Of course, various tests are done intermittently because of the treatment, X-rays, put-on tests to see how we're progressing and that we're succeeding. Now, it's not every time that treatment is successful, even though most of the time treatment is successful. Some people have treatment failure, and the commonest cause of that is actually poor consistency use of medications, as the truth. Okay, some people also can have a relapse, in which after they are supposedly were getting well before, the sputum will become negative, and then suddenly you have that again. Okay, so But most of the challenges with treatment can actually be avoided by making sure that the medication are used exactly as prescribed over time. Apart from the medications, are there other things that can help a patient with tuberculosis get better on time?
Yes, improving the immune system can also help.
How can they improve their immune system? Supplements or
supplements?
No, it's more of diet, I would say.
Diet,
So healthy diet. So for that, malnutrition goes hand in hand with tuberculosis. Many patients with tuberculosis can lose a lot of weight. They can lose appetite, feel very unwell. Okay, so nutritional rehabilitation is important for these patients, and we have a dietitian, Cynthia, can talk a lot about it. So, but improving the amount of calories they take in, improving the amount of protein they take in, can help their body boost their immune system and the ability to regrow, regenerate, regain the weight they've lost, and of course be able to fight the condition. In fact, one of the key metrics we use when we're assessing someone that had tuberculosis on their response to treatment is how much weight they are starting to gain. Okay, we check how much the cough is, whether the cough is less, whether fever has gone down. Okay, but very importantly too, we check that they're gaining weight. If you're getting thick, that's positive mark in all of these features. You know that you're getting improvement. Okay, of course the chest X-ray is also repeated during the course of treatment, and those are the things that help us know that the person is getting better. So, when last did you manage someone with tuberculosis?
That's 3 days ago, 2 days.
Oh, right. So 3 days ago. That's very interesting. So I will ask you that, what are the challenges you've had in treating patients with tuberculosis before?
Okay, the challenge one is most of the patients I've handled, most of them are not very patient enough, one, and some of them are very difficult to handle in the sense that some of them believe that they are stigmatized when they come into the hospital, which is really not what we are aiming at.
I'll just come in from the first part you mentioned. So it is actually true that TB is stigmatized, and some people feel maybe shy, now that they've been diagnosed with TB, and then they feel somehow. And I think it's very important for us healthcare professionals to warm up to these patients and make them feel comfortable with us that we're treating them. The fact that someone has tuberculosis does not now mean that you should be jumping from the person. No, of course you keep the person at a kind of like arm length, try to wear your face mask, get the person to wear the face mask, and then see the person in a fairly well ventilated area. So those things are important. I think what you did mention earlier during our discussion that they get tired of the treatment. It's not easy to take 6 months length of antibiotics, that's the truth. And also the medications are quite many. So mentioned earlier that it's a combination of a number of antibiotics, like up to 4, and then so the number of medication that the person is taking and the duration that the person needs to take it can be tiring. And usually we as healthcare workers, we need to motivate the patients. Family members need to support, to encourage, so that they pull through with their treatment. Because when people don't pull through it, they don't complete their tuberculosis treatment. It's one of the things that leads to drug resistance. It also makes the person not to get better on time. Okay, and of course, a patient with tuberculosis that has not gotten well on time is likely going to infect another person. So because I can tell you to move to your basement because you have TB, but there's only so long you can stay in your basement. When you stay in your basement for 1 month or 2 weeks to 1 month, you want to come out. Okay, so if you're not using your drug regularly and the TB is still there actively at that time, you will likely you infect somebody. So the earlier we get the person to be clear of the TB, the better for the overall community, okay? And of course, we don't want people to have side effects of medications. We don't want them to have complications of the tuberculosis. We don't want drug resistance, because drug resistance is one of the big problems we have. The medications are generally well correlated, actually. Of course, typically we monitor the liver function test. One of the drugs can make urine maybe become slightly orange color, which is harmless actually. Okay, but the drugs are generally well tolerated.
That's why they need proper hydration.
Absolutely. Thank you for adding that. So people, when you're taking medications like that, you need to drink enough water so that at least the drug can work very well in your system, and then you can clear out any byproducts out of your system. As I said earlier, that drug resistance is a very big problem with tuberculosis, and there's what we call multi-drug resistant tuberculosis. Sadly, there's also what we call extensively drug resistant tuberculosis, that's the XTR-TB. The first one is MDR-TB, the second one is XTR-TB. Now, I did mention two tests we did earlier. Okay, I mentioned earlier that we do, after culturing the tuberculosis, you can do drug sensitivity tests. It's not widely available, but it's important to do that, to know that the tuberculosis you're about to treat is sensitive to the antibiotic that you want to use to treat it. Okay. Beyond that, if the if you can't do the drug sensitivity test, the other tests I mentioned, the gene expert test, can also actually tell you whether there's resistance to at least one of the critical drugs used to treat tuberculosis. And if that comes out positive, that is, there's a resistance to that drug, it means that there's some trouble, and you need to find a way to test for a full sensitivity of the drug of the tuberculosis you cultured to see what drugs will work. Okay, because if you're giving someone a drug that will not work, it will not work.
Yeah.
Okay. Now the other thing to mention is that people get resistant TB by two methods. Either you get a TB, that the TB, so let's say Mr. Ali is acquired TB now. He acquired it from Mr. Issa, who he did not know, but Mr. Issa was someone that shared space with him at some time. Okay. If Mr. Issa originally had a TB that is drug resistant, maybe because he did not use his drug regularly, okay, and he infected Mr. Ali with that drug resistant TB, Mr. Ali will have a drug resistant TB. Not because he did not use drug well or something else he didn't do, but the strain he acquired was ab initio resistant to some of the drugs, some of the key drugs. So that's someone having what we call primary drug resistance. Okay, but sometimes some people, they have a normally sensitive, and that's a very bad business. So again, I've mentioned earlier that our role in preventing drug resistance in TB is multiple folds. Number one is that we should avoid abuse of antibiotics, which is very common in Nigeria. It's
balanced diet and also supplements themselves to improve and support their immune system. So that's
and I love that nursing perspective. So what you said is very, very solid and accurate. That it takes them, the response to treatment is kind of like longer and more sluggish because of the weak immune system. It's very important to also know that the presentation, the way it shows in someone that has HIV is kind of like different, because the normal immune response to a bug in the system is not there. So if you has tuberculosis and then and you expect cough, weight loss, but they can present in a different way, and you need to be more, we as healthcare professionals, we need to be more alert and have a high index of suspicion to pick that this could be tuberculosis in someone with HIV. Okay, and of course, the more success we have with HIV treatment, then the better off people living with HIV. They will have a less risk of developing TB, and of course, they will have better treatment outcomes from tuberculosis. So I think those are the key things to talk about. And in people with HIV, it can be quite a challenge. There are a lot of drug interactions as well, so we need to carefully select their drugs. But overall, there's still a lot of fulfillment in treating someone with HIV or TB, and by the time you clear the TB in them, they tend to get better, they tend to gain weight, they look fresher, and they're happier. They're able to function very well in the society, which is what we want. How about TB vaccine? Why are we still having TB despite vaccination?
exposure, basically.
Okay.
Exposure to tuberculosis, and most people do not take this vaccine. Most people don't take this vaccine.
So apart from that, actually, even among people that take the vaccine for TB is not that very strong. That's its effectiveness. So it's only partly effective. It is effective, but the effectiveness is not that. So it's, what we say is that it's able to prevent a life-threatening form of tuberculosis, particularly at the extremes of age. So for example, for children, in populations that are well vaccinated, the rate of children dying from tuberculosis is less. But they might still have it, but instead of it to come in and attack them vigorously and kill them the way it killed people in the 1930s, 1940s, they will still be able to shake and release a bit until it's diagnosed and until they get the most appropriate treatment. I don't know how many questions has been sent in. We encourage us to send in our questions you can just type a question in the chat box. You can also send it by DM so that we address our questions. It's an interesting topic. So I don't know, do you have any questions for me?
Okay, so some people actually do take it in the afternoon. Then just 3 hours later, maybe 3 hours remaining till in the evening, they'll take the next dose. What do you think about that?
Well, I think the best way to avoid that is actually to use the drug once daily. So TB medications are typically once daily, or I know that some people divide it, they take some in the morning, some in the evening, but if they take it together, it actually saves that problem. But that said, in antibiotics generally, it's better to use it at a specific time. And if the drugs are muted, it depends on the time. It depends on how close it is to the next dose anyway. If it's very close to the next dose, they should just agree that they've skipped the dose and just use the next dose. Okay? If it's far from the next dose, then they should take it and still take the next dose as well. So it depends on how proximal it is to that part.
Okay. Another question is tuberculosis hereditary? Can it be passed from one generation?
Okay, very good question. I think I've heard that question before, and definitely tuberculosis is not hereditary. So you cannot pass tuberculosis from father to son, or from mother to child, basically. So tuberculosis cannot be passed like that. So, but it can be passed. It can be transmitted by what we call droplet, just the way COVID is transmitted. So it can be transmitted by talking, by coughing into the air, by laughing, by singing, just sharing the same space for a prolonged period. We don't breathing into the space once it's for a prolonged period, so it can be transmitted by that. I've had the question also that can TB be transmitted through kissing. I've heard that before. Because TB can be present in saliva, so technically it can be transmitted through kissing, even though it's more of a droplet infection, but because it's present in the saliva, it definitely can be transmitted through kissing. And we know that we breathe in each other's mouths during kissing.
Okay, so for tuberculosis resistant strain, what can be done with individuals with that kind of tuberculosis?
For people that have resistant tuberculosis, either single drug resistance, multi-drug resistant, or extensively drug resistant, it needs to be treated in dedicated centers, not just ordinary TB centers, but in TB centers that are dedicated to be treating drug-resistant tuberculosis. Because, as I said, it requires much more advanced treatment, more complex medication regimens. Many times the person needs to be admitted actually for a very long period of time sometimes. So the person definitely needs to be seen in a center that is specialized for treating drug-resistant tuberculosis. I've also had a question before, that is TB curable? What's your short answer to that?
Yes,
absolutely. So TB is a curable disease. It responds very well to the medications we use to treat it, and after the prescribed course of treatment, which is typically 6 months, usually the vast majority of people that have tuberculosis know